Welcome to week 7. Can you believe it? We're almost halfway through this term. And as I tell you, is remember that the way to learn this terminology is best is by repetition, listening to the audio, reading it, writing it. That is what's going to help you get to know. And you're still not going to know everything. You're not going to remember everything. And then it'll depend on where you head in your career and what specialty you might involve in as to what words will pop. But again, that's why I've been doing this for a very, very long time, but I still love it. But still, I keep 3 different medical dictionaries within arm's reach as I do my work, because accuracy is the most important thing in healthcare. Okay, so this week we're going to learn about the lymphatic system. It's really an unappreciated system of the body, but it's very important because it is the foundation, the basis of our immune system. This is what, when working properly, it is the soldiers that fight against pathogens that we encounter all the time. And so that is, of course, a very important thing. When it doesn't work properly, that's when we get sick. And further, you may know some people who have what are called autoimmune diseases, which means that the lymphatic system is confused in that part, and it is misinterpreting a friendly for an enemy. And so it attacks the friendly, and that's the auto. It means self, remember? Auto means self, and autoimmune means it's attacking against your own immune system. And that makes it kind of complicated, not for the specialists, of course. So what we have throughout our body, as you saw in that picture, is a network of lymph nodes. And you may have heard this. They are throughout the body. So we're going to go through them. You have cervical lymph nodes, which are in this cervical spine area. That's your C1 to C5 from the base of your brain to the top of where your thoracic cavity begins. Okay. Then you have your thoracic lymph nodes, which interestingly are located in the thoracic part of the body. You see how clever they were? Okay, which you know is your torso, right? Essentially from your neck to your waist. Then you have your axillary lymph nodes, which are in your armpits. And sadly, if you've ever known someone who has had breast cancer, and when they talk about, and the malignancy has spread to the axillary lymph nodes, that means these in your armpit, okay? You have supratrochlear lymph nodes, which are at your elbow. Isn't that a weird place for these to be? Okay, abdominal, which are in the mesenteric and your lumbar lymph nodes. And remember, when we did the skeletal system, your lumbar part of your skeleton of your spine starts right here at the waist and goes down for this area. So that in the front coordinates with your abdominal area, which is the mesenteric. Iliac lymph nodes are in your pelvis. And you remember the ileum with an E, I-L-E-U-M, is the end of your small intestine where it goes to meet the beginning of the large intestine. This is iliac with an I, which, if you remember, is the iliac bone that makes your pelvis. But the good news is they're both generally in the same area, so that still gives you that idea of where they're located. Inguinal lymph nodes are in your groin, like further down where your thigh meets the base of your body. And popliteal lymph nodes are in your legs, lower extremities. Okay. Were you raising your hand to ask a question? No. Okay. Just checking. All right. Okay. Now, this is not correct. Oops, we have an interloper. Oh, wait a minute. Come on. Goodbye. There you go. Thank you. Okay. As you can tell, I used last week's PowerPoint and then just replace each of the slides. So one got by me. Oops. Oh, well. All right. Back to the lymphatic system, the thymus. The thymus is a gland that is part of the endocrine system, but it also functions along with the immune system because the thymus creates hormones that encourage T or thymus lymphocyte production. Remember lymphocyte, okay, site cell, lymph cell, okay? And you may have heard references, hopefully on television, where a patient, for example, who is HIV positive, where they track their T cell production, okay? Because these cells provide immune defenses. And your thymus is located right here where your trachea, okay, comes down as it is about to enter the lungs. The thymus is kind of wrapped around that. Okay, so it's like right here. Oh, wait, no, yes, right there. Okay, the spleen, again, very familiar with splenectomies if you watch certain television shows. The spleen, you can live fine without it, which is weird, right? It's weird that it's an important part of your body, but you could live fine without it. It's kind of like the gallbladder, you know? All right, so the blue on the torso shows you where it's located. So your spleen is located right here, but it looks like that. And it is like a coffee filter. So it filters out cellular debris. Isn't that something? We can never get away from garbage. Even our body produces garbage, okay? So the red pulp in the spleen includes lymphocytes and macrophages, which clean out cellular debris as the blood is flowing through it. And then the white pulp part of the spleen contains lymphocytes, which attack organisms. So this is kind of like fight off disease central, which is why when somebody has a splenectomy, and that's taken out, yes, you can continue to live, but you must be very careful about protecting your immune system from the outside, because one of your inside powerhouses is no longer there. Does that make sense? Oh, good. Okay.
Yes, ma'am.
All right, and then the last part of the lymph node system that we're going to talk about are your tonsils and your adenoids, which is another dual functioning part of the human body. If you remember, we talked about the thymus, which is a dual functioning. The tonsils and the adenoids are considered actually part of the digestive system, but they really are teeny tiny little masses of lymphatic tissue. And their job is to entrap pathogens, which if you remember when we talked about infectious diseases, bacteria and viruses, and pass them into the tonsillar lymph nodes so they can be eliminated. And this is one of the reasons why, if there is a dysfunction, again, they can be removed without any negative impact on quality of life. But now you understand what they do. So again, if somebody has a tonsillectomy or an adenoidectomy, remember the suffix ectomy means to surgically remove. So you see how handy that is? If I say tonsillectomy, now you know, oh, the tonsils, the tiny mass of lymphatic tissue at the back of the throat, and then ectomy, surgically remove, we already know that ice cream is on its way. I never had a tonsillectomy, but I have had ice cream. Isn't that interesting? Okay. All right. So, I always like to reinforce no matter where you are going in the healthcare system with your career, whether it's on the clinical side or whether it's on the administrative side, this is an example of a real patient record. A real physician wrote this. And I highlighted some of the key terms that are used very normally in these records that you can see are written not in English as we know it commonly, but using medical terminology. So it's important that you understand what the physician has identified going on with this patient, so then you can do your job, whether your job is as a nurse, where you're going to, initiate treatment, for example, administer an antibiotic or take the patient down to x-ray or to surgery or whatever. Or if you're going to become a medical record coder, you have to know this because you have to translate those terms into codes to report why this patient needed professional care and what specifically was done for this patient. So malaise is, it's fatigue, it's exhaustion, it's, a negative aspect of malaise might be called laziness, okay? But it's not laziness because it's physically induced, not mentally induced, okay? It's not I don't want to, it's I can't. All right, tachycardic means, tachy means fast, cardiac means relates to the heart, right? So tachycardic is rapid heartbeat. Bilateral, you want to give it a shot?
Bilateral on two sides?
Very good. Both sides. Both sides. Yep. Cervical lymphadenopathy. Okay, sometimes they're hard to pronounce for me, and yet other words twice as long. But anyway, okay, so cervical, we know it's referring to this cervical, the neck, okay, and then lymph, we just discussed lymph, right? So this is a lymph node. Adenopathy, pathy means dysfunction or pain, okay? And then we see the pharynx in your throat, right above the larynx, okay? Pharynx, tonsils, and buccal mucosa. Now, buccal mucosa, I should have highlighted that too. Buccal mucosa, you again, the things you learn from the things I learned from television, but I always double check them, okay? Is if you've ever seen someone on TV, they do this for DNA. They'll take a long swab and they rub it on the inside of somebody's cheeks. That's called a buccal swab. So the buccal is inside of your cheeks, is the buccal, and mucosa is the membranes, the tissue in the membranes. Okay, so this patient's pharynx at the top of the back of the throat, tonsils, and inside of the cheeks are red and inflamed. And her tonsils are studded with white areas of exudate. Exudate is the excretion of fluid, maybe a little pus and stuff. It's icky, but you're not going to know that. Okay. A throat swab was taken before starting antibiotics to confirm that she had strep throat. Oh, but she doesn't. Strep throat, diagnosis of acute bacterial tonsillitis. Beta hemolytic streptococci is the bacteria. Okay. All of which is very important. Okay. So again, if you're on the clinical side, you have to know whether the inflammation in this child's throat was because of bacteria or virus or fungi or something else. Because, as I'm sure you've learned from COVID, if the cause of the infection is a virus, then taking antibiotics, which is anti-biobacteria, is not, that's like saying, okay, I have the SWAT team coming and they're wearing bulletproof vests. So I'm going to use my water pistol to stop them from entering, right? All it's going to do is make them madder. Okay. You have to align the treatment with the actual cause. Otherwise, it's not going to do any good, is basically where I was trying to go. So you can see that this is why we all, everybody in the building, in the healthcare building, needs to understand medical terminology, because this is going to be part of your everyday. Okay. So, you know, I always tell you review often, because that's how it's going to remember and stick in your head. Use your medical dictionary, because accuracy is the most important thing. And query when necessary, because asking questions is important. And you cannot read the mind of the physician. Nobody can. Ugh, you don't want to go in there. I was talking to a friend of mine who is a doctor, and he was talking, I asked him a question, he was explaining something to me, and I said to him when he finished, I said, you know, if I didn't know you were a doctor, I would know you were a doctor. So we have to ask, because they don't know what we don't understand. They don't know what detail we're looking for, because they're not trained in our jobs. Okay. And I also want to remind you that there is a tutor available for you. Monisha is sitting there waiting to help you in anything you want with medical terminology, whatever your questions are. You can call and make an appointment for one-on-one, and her appointments are Wednesday evenings from 6 p.m. to 9 p.m. And always, always remember, I am available to you. I am available to you. You email me. I promise you a response within 24 hours. Okie dokie. Okay. I just want you to remember that on the personal side, you get so much value from understanding medical terminology, regardless of where your career path will take you. So, questions, comments, considerations, concerns, compliments?
You look nice today.
Thank you. All right. You have a wonderful day. Stay safe and be well.
See ya.
Bye.